Hello, everyone. Thank you so much for joining us today, and welcome to the application Q&A webinar for the Trinity Challenge on community access to effective antibiotics. My name is Louise Gough, and I am the Chief Operating Officer of the Trinity Challenge. And we're so delighted that you've joined us today to hear more about the £1 million innovation competition and to get your questions answered. So on to the agenda and why you're all joining us today. It's a very simple agenda today. What we'll do is we'll recap the challenge's key parameters, and we'll also get some top tips for applying from our partner, MIT Solve. We'll then open the floor to your questions and try and get through as many as we possibly can. But don't worry, if we don't get to your question today, we can answer that by email afterwards. So on to the next slide, please. Just some housekeeping. So we'll be using the Zoom's Q&A function. That's where we will collate your questions. So if you have a question at any point from now onwards in this webinar, please submit this using the Q&A function. As I said before, we'll get through as many as we can. Just a general note, please be aware that in this session, we won't be able to comment on your specific solution idea, but we'll mainly focus on the eligibility criteria and clarification of the application process. The judgment of the merit of your ideas in your applications will be made during the formal judging process. As well as the Q&A function, the chat function is also available. I can see some of you already using it, and that can be used for anything that isn't a question for our panel. For now, it'd be great to hear from you and find out who you are. So please use the chat to tell us where you are in the world, where are you joining us from today, your background and your name. So today, I am absolutely delighted to be joined by Dame Sally Davies, founder and chair of the Trinity Challenge, and the UK Government's Special Envoy on AMR, and Noel Shaskan, Health Community Lead at MIT Solve, who will both answer your questions. Before we get into the practicalities of the challenge and how to apply, I'd like to invite Dame Sally to say a few words about the Trinity Challenge and why improving community access to effective antibiotics is so vitally important. Over to you, Sally. Thank you.
Thank you so much, Louise, and welcome everyone who's joined us today. It's really encouraging to see the very high levels of engagement from our network for this new challenge on AMR. Many of you are, we can see, sharing and amplifying the opportunity through your own contacts. So thank you very much for helping to bring this important mission to life and for being here today. Last year, for the Trinity Challenge on antimicrobial resistance, which was our second challenge, we received 285 submissions from 57 countries. And having announced our 4 winners last summer, it's been wonderful to see these projects set up and start to implement their ideas. I'm really hopeful about the impact that they can make in Vietnam, in India, in South Africa, and even potentially further afield as they begin to scale their work. I'm sure that there are bright minds and innovators everywhere, but here today joining us as well, who can go on to join our 2 previous cohorts of Trinity Challenge winners. I certainly hope so, as the world really needs your help. This problem of the antibiotic emergency is really urgent, and it's steadily growing. Since our 2024 challenge, new data has been published, and it makes for sad reading. As our most important response against bacterial infection, antibiotics underpin the success of modern medicine. We all know that, so why do we put them at risk? But from surgery to chemotherapy, antibiotics make life-saving treatments possible. They save lives of women and babies. But we know, put simply, these drugs are losing their effectiveness. The worst case scenario is really unimaginable. Many of you already know that the second GRAM study out of the burden of disease team reports an estimated 39 million deaths are going to be caused by MR by 2050 if robust action is not taken. That's on top of 36 million deaths since 1990. And they've been doing work to show that more have died of AMR than climate change. And this century, vastly more numbers are going to die of AMR than climate change. So why isn't it seen as an emergency? Proper access that is essential, because we do want to limit use of antibiotics. We don't want misuse. We don't want them used when they're not needed, whether in animals or humans. But if you don't have access, people die. But we've also got to make sure we have quality antibiotics available to treat infections with the appropriate antibiotic before there's a chance for the bacteria to be passed on to other people and between them and animals and through the food chain, or as well as before they develop drug resistance. That's why in this Trinity challenge, we're focusing on barriers that prevent access to effective antibiotics. The two big issues that are promoting resistance in antibiotics are those of stock control and substandard and falsified oral antibiotics, counterfeit antibiotics. Those substandard and falsified antibiotics, as I said, often known as counterfeit, account for around 10% of human antibiotic consumption in low and middle income countries. So people think they're getting antibiotics. They think they're using their hard-earned money to buy them. But in practice, they're buying something that either won't work at all or will drive drug resistance. Improved stock control also, obviously, ensures antibiotics reach those who need them most. After all, of the 7.75 million people who die of bacterial sepsis each year, the burden of disease people tell us almost 3 million have infections that could have been treated and therefore lives saved with commonly used oral antibiotics like penicillin and amoxicillin. And we know these drugs are generally low cost and less likely to drive antibiotic resistance. So they certainly need to be available widely. But with major supply chain and quality issues, sadly, we know that this often isn't the case. And tragically, it's the children aged under 5 in low and middle income countries that are particularly impacted. Our hope from the Trinity Challenge is that by focusing specifically on stock control and substandard and falsified oral antibiotics, we will generate high quality, cost-effective and impactful digital or tech solutions. Whether you're an expert in antibiotic resistance or even a relative newcomer to this issue, we all have roles to play. As I've said, we're in the middle of an antibiotic emergency, and collectively we need to take action now. By being here, you've already shown an interest in being part of the response, and I hope that through the rest of the session, you'll feel inspired to bring your ideas, data solutions, analytics and tools to this challenge, and ultimately mitigate the impact of antibiotic emergency, and then you'll be saving lives. So now, thank you to all of you, and I'm handing back over to our Chief Operating Officer, Louise, to go into a little more detail on the challenge parameters. Over to you, Louise.
Thanks, Dame Sally. I'm sure that has inspired our prospective challenge teams to take action and apply today. So thank you very much. Before we move to the later section of our agenda where you can ask your questions, I'm going to take you through the main parameters of the challenge to set that context. I think it will be helpful and will help frame your questions. So let me start by talking about the main challenge question. So most of you will know by now, you will have been interested in this and this is why you are here today. But we have a very specific challenge question that we're trying to answer through this competition. And that question is, how can data and technology improve stock control and or reduce the use of substandard and falsified oral antibiotics for community use in low and middle income countries? And we'll come on to talk a little bit more about why these areas are so important. But that question is central to your applications. And just so you're aware, you have just under 4 weeks to apply. So our deadline is the 24th of April. We'll put the challenge platform link in the chat for you to have a look at, or you can use the QR code on the screen. So please do have a look at that platform if you haven't already. There's a huge amount of information and lots of FAQs on there already, which we can add to after today's session. I recommend you spending some time reading through it all before you apply. So let's talk about the two major issues that Sally has already mentioned. So the challenge focuses on two major problems: stock control and substandard and falsified oral antibiotics. So we're looking specifically for data and technology solutions which improve these issues, specifically at the community level in low and middle income countries. Applicants can tailor their solutions to either of these categories. You may decide to put in an application that covers them both, but you don't have to. This is not mandatory. You can submit an application on just stock control or just substandard and falsified oral antibiotics. The reason we set this broad brief is because we know that there's a big issue and we really don't have access to enough data in this space. So by leaving it fairly broad here, we're hoping to see some amazing innovations come forward. So on to the next slide, please. So the exciting part. We have an amazing prize fund to allocate for this challenge. So we have £1 million in the prize fund, and we aim to distribute this in 2 grand prizes of £500,000 each. We're hoping to find one solution for stock control and another on substandard and falsified oral antibiotics. This is our aim, but the final decision will be made during the judging process later in the summer. If you join our challenge and if you are a winner, you also have access to our amazing members who you can find on our website. And what they do is support and enhance winning projects with opportunities such as networking, mentorship and collaborations, which is really fantastic. So on to eligibility. We will talk, I'm sure, a bit more about this in the Q&A section, but just to frame that for now. As I've said, it's really important that your solution is focused on a low and middle income country and its impact in the communities there. This is because this is where the highest burden of AMR is. We are also interested in community level data. So the majority of the data on AMR comes from high income countries and formal settings, such as industry, hospitals, large scale food production and laboratories. So for this challenge, we're specifically looking for solutions which use or generate data from outside of these settings at the community level because of this major gap in our understanding. We're also interested in One Health. So this is a One Health challenge as it was last time, and solutions can focus on any combination of human, animal and environmental health. But given the nature of this challenge, we expect solutions to be focusing mainly on human and animal health. But of course, they are all interconnected. And finally, but not any less important than the other ones, innovation. So we're after some new innovative uses of data and technology, maybe new applications of existing technologies that can rapidly enhance our response to these issues. This challenge is open to lots of different solutions at different stages of development, which is very exciting. So we are looking for solutions that are from proof of concept upwards, up to scaling. So proof of concept in relation to this challenge, it refers to a project that has already built preliminary evidence or data. So unfortunately, we can't accept completely conceptual ideas. We do need some evidence in the application that something has been tested in a community or the idea has built some evidence so far. We can talk a bit more about that later. And then in terms of the judging criteria, you can find more information on the challenge platform. But we have an independent judging panel. Those judges have been announced, and again, you can find those on our website. And they're an amazing panel of multidisciplinary experts from around the world, specifically selected for their expertise, both in AMR, in global health, security, and in this challenge in particular. So please look at those judges and the judging criteria, which will help you shape your application. The judges will use those 8 criteria that have just been on the screen to deliberate. So on to who can apply. We do get quite a lot of questions about this, so let me set out who can and can't apply at this point. So applications are welcomed from a wide range of organisations. So for example, NGOs, universities, technology companies, social enterprises, and groups of organisations can apply. So partnerships and groups organisations, it's not a mandatory expectation for this challenge, but we found in the past that due to the nature of this issue, multidisciplinary teams are often the most effective at finding a solution. So I'm sure that we will get lots of applications with multiple partners involved. The challenge is open to organisations from all around the world, but as I've said, and I can't emphasise this enough, solutions must directly benefit low and middle income countries. So you can apply if your organisation is based in a high income country, but you must have a bona fide partnership with a low and middle income country organisation. There are some restrictions, as you can see on the screen. Governments, agencies and pharmaceutical companies and larger scale for-profit companies can't apply to this challenge. There is full details available on our challenge platform, so please do take a look. This is an area where we get lots of questions, so if you want to email us, please do so, and we can help you work out whether you are eligible to apply. So now on to what you can and can't use the funding for. So the £500,000 funding, which you'll be asked to apply for in the platform, will be used to deliver your solution, and it will be broken down in the budget into 3 category areas. So the first one is direct costs, and those are costs that arise exclusively from delivering the solution that you're applying for. And an example of that might be salaries or travel costs or equipment related to the solution. Then we have a category called real indirect costs, and those are costs that arrive from delivering the solution, but they can be shared with other projects in your organisation. So, for example, you might share some IT hardware, or you may share monitoring and evaluation expertise in your organisation. That's all fine. And the main restriction on the amount that you're allowed to put into the budget is on overheads. So true overhead costs, these are general organisational costs that exist with or without this solution in your organisation. So an example of that could be office rent or administration costs, and there is a cap on that for this challenge. So you can only apply for a maximum of 10% on the total award for these overheads. Another very important point here is that we are looking for the majority of the funding to be spent in lower middle countries, because that is where the solution will be deployed. So at least 60%, and we hope more if possible, must flow to LMICs. This is, like I say, very much a minimum. We really want to see as high a percentage as possible. And that means, therefore, that if your organisation and you're a partner in this challenge are based in a high-income country, the funding that you will allocate to your organisation in a high-income country is capped at 40%. So a quick look at the timeline since February, when we launched this challenge. So as I said before, we've only got just under 4 weeks until the application deadline on the 24th of April. What happens after that is we have various different stages of judging. So there's an independent judging process, and shortlisted solutions are invited to pitch and interview with the judging panel in July. We're very grateful for our judges, so I just want to take a moment to thank them here for their time in advance. They're really a brilliant group, and we can't wait to start working with them. We will expect to announce the challenge winners in August, and then we move into a contracting period and due diligence. And the winners will commence the work for their solution in November this year. And there is a maximum of 2 years for these projects. So if you're hoping for a few top tips for your application, now is the time to pay attention. So I'm going to pass on to Noel Shaskan from our partners MIT Solve, who will share some top tips for you and how to use the application platform if you haven't got to grips with it yet. Over to you, Noel. Thanks.
Thanks, Louise. Hi, everyone. It's really lovely to be here with you all. Like Louise said, I wanted to give a few tips about using the application portal. So first off, before you get started with your application, Louise mentioned this earlier, but I think it bears repeating. Make sure you review the overview and in particular the judges and criteria pages on our website. They have a lot of really good information, and it might help you to think to understand exactly what we're looking for and also how your application is going to be evaluated. That might help you think about how you want to frame certain things or what information you want to give priority in your application. There's also a really detailed frequently asked questions list that might be able to answer some of your questions if we don't get to them today. When you're ready to start your application, you just click the yellow square that it says start your solution. Next slide. And then once you're in the application portal, what you'll see is a little navigation bar on the left-hand side that's going to show the different sections of the application. So the nice thing is that you can click around those different sections without having to fill out the application. That means that you're able to see all of the questions that you'll be required to fill out without having to go through every section and fill them out. It's a good idea, if you haven't already, to just kind of click through and look at those questions so you have a sense of what you need to answer. There will be certain questions that require a little bit more forethought versus just selecting drop-downs. And you may want to do that sort of offline before you actually fill in on the website. One other thing that is new this year is something we're calling a solution profile. It's kind of the top level information about your solution and your team. What you're able to do is save that information in our system, so it makes it really easy to apply to future challenges hosted by MIT Solve. So definitely recommend that you try that out. Next slide. All right, tips in terms of filling out your application. So first off, try to be concise. I know there's a lot of really rich detail about the work that you are doing, but more concise solutions or applications typically do better. I would also recommend that you try not to be overly technical. Most of the really successful solutions that we see are able to communicate really complex concepts in simple language. If there are questions that are not required, we still recommend that you fill them out. Typically, solutions that get further along in the process are ones that have filled out every question. The next one's a really important one. Please don't wait until the last minute to submit. After you click submit for your application, you can still continue to edit your application until the deadline. So every year we get folks who come to us in a panic because they've missed the deadline. They can no longer click submit. Please don't be one of those folks. We want to be able to see and review your solution. As soon as you filled out the application, click submit. Even if you want to make tweaks later, you can go in and edit. Finally, if you have any technical issues or questions that are specific to the application, you can always reach out to us at MIT Solve at help@solve.mit.edu. I know there's also the info Trinity email. Feel free to email either one. We'll get the question to the right person and get back to you. All right, I think it's back to you, Louise.
Thanks, Noel. Super helpful. Thanks so much. Okay, so I hope this first section of the webinar has been helpful and helped to set the context for this Q&A. If you do have a question, please use the Q&A function in Zoom rather than the chat, and we'll work our way through as many as we can. As I said before, if your question is very specific or quite complex, we may ask you to email us and we'll get back to you as soon as we can. But we'll try and get through as many as we can today. We won't be able to give you views on your ideas specifically, but we can advise as much as possible on how to apply and the eligibility criteria and the reason for running this challenge. So on to questions. I'd like to invite Noel and Dame Sally to join me on this panel and to start answering some of these questions. So thank you both. The first question I'd like to ask Sally, if that's okay. What type of data is considered to be community level?
So we're talking really about data outside traditional settings like hospitals, formal healthcare facilities, the pharmaceutical manufacturers and large-scale food production plants. So what sort of data sources are we thinking might be included? So this isn't a full list. You may come up with better, but they're not limited to by what I'm saying. But it might be data generated by pharmacists, by vets, by farmers, community health workers. And don't forget shops, markets, and small-scale suppliers to these people, because those are all in the community serving everyday people. And what we're trying to do is make sure that everyday people in their farming or their own health gets the treatment available and of quality. Thanks.
Thank you. And if I may, a follow-on question to that, because we get lots of questions about the type of data. Can we accept traditional data sets, so from hospitals, manufacturers, or health facility level data?
So some of that could be useful if it's linked to community data and other stuff, but it isn't about that data. So the community data must be integral to the solution, but I can see that you might, to look at stock control, want to go from the big supplier and all through it using, I don't know, blockchain or something. But we're interested in the community level getting the right solutions, and therefore that's the big focus. I mean, and it doesn't just have to be data in terms of numbers. What role does photography play? What role does other sorts of data play? So think hard about what data will help you improve stock control locally and quality medicines. Thanks.
Question for Noel next, if I may. So can existing solutions be adapted to this challenge? So they may not necessarily be working in antibiotic stock control or substandard falsified medicines, but the technology exists. Can those be applied to this challenge?
Yes, we absolutely encourage folks who are working with an existing solution that they think could be adapted to be applicable to either stock control or substandard and falsified antibiotics to apply. I think one of the main questions that also comes up when folks are working with this type of solution is about how they should categorize their stage. And what we recommend is that you in your application, you reflect the current stage of your existing solution versus whatever stage it would be if you were applying it to the field of antibiotics.
Great, thank you. And just a follow-on question for you as well. Can solutions just be an idea, or do they require some form of pilot implementation beforehand?
Yep. So the eligibility criteria states that solutions need to be proof of concept. So that means that there needs to be a working prototype with some sort of preliminary data. Unfortunately, we're not able to accept concept level solutions.
Great, thank you, Noel. I've got a question for you, Sally, now. Can the solution be research-based, or do they have to have a product?
So that absolutely follows on from the last question. You can give us a proof of concept, but we want you to have built the first version of it and got some preliminary evidence or data to show us. Because while there's no exclusion for research-based projects, I mean, innovation is taking something from one area to another or research-based, you've got to show how you meet our judging criteria, such as the potential for impact and innovative approach. And that may be more challenging to evidence through a traditional research project. After all, we're looking for solutions that really make a difference to people as they live their lives. We're looking for impact. So just a research project in a standard way, or you know, a great idea but not developed and no evidence, it's not going to end up funded. Thanks.
Thank you. I'm just going to take one of these questions myself. So we've had a question around how many applications can teams or organizations put into this challenge. There isn't a restriction on you putting in more than one application, but we really would strongly advise you putting your best efforts into your one application if you can, to have the best chance of moving forward. But like I say, there is nothing stopping you. In larger institutions, so for example, in universities, there may be a reason to have multiple applications, but each should have an individual team and a distinct idea. So we really do encourage you to think carefully and try and work with your colleagues in your organisations to put your best foot forward and your best and strong application in. So let me just see what other questions are coming through. I have a specific question for you, Noel, around the application itself. So could you talk a bit more about the elements that the applicants are asked to submit in terms of evidence, the 2-minute video? What are we looking for there?
Sure. So there is an option to include a 2-minute video in the application. However, it is not required. I've seen this be successful in a variety of different ways. One option is to give a quick rundown or an overview of what you're working on. I would suggest not spending much time at all on the problem. We all know what the problem is. That's what this challenge is all about. Spend as much time as you can talking about your solution, what makes it innovative, as well as your team, would be my suggestion. I've also seen videos be very successful when they cover information that is not addressed otherwise in the application. So for example, if you have a physical product, you want to give a demo, something that doesn't really translate well to the other questions that are in the application, that video can be a great option. But again, it is not required that you create a video.
Thanks, Noel. That's great. And the next question is around the types of solutions that may come forward. So Sally, if I can direct this question at you. The question is, what if countries don't have the approved equipment in place to check the quality of drugs? I imagine that's going to make the solution incredibly difficult to deploy.
I think it wouldn't fly if you can't. You can have a great idea, but if you don't have the equipment, you can't do it. So either you've got to have the equipment or you're finding new and different ways of doing it. I mean, what we're hoping is that you'll think about what's available to you and perhaps talk to some of your engineers and chemists. Can you come up with new, frugal ways of doing it? Because if you can, even if it's only one antibiotic and you've shown it works, you could give us a plan for how you would then put it into practice. So either what's out there or new ways of doing it.
Yeah, that's great. And I just at this point would remind colleagues on this webinar that there's only 2 years to deliver your project. So you really do need to know what's going to be approved and work in advance, just to a large extent for this challenge. There's just another quick question I can answer here. So there's a question around, should the solutions be positioned in the private sector or the public sector? That can be both. Obviously, there's eligibility criteria about the types of organisations that can apply and where the funding's going, and your budget, but there is no restriction on whether it's private or public sector. So I can tick that one off. This is again a quite specific question for Noel about the MIT platform. So it says, if I've started my solution as an individual, can I convert that solution to a team application later on?
This is one I don't know off the top of my head. However, what I would suggest is that you reach out to us at that help@solve.mit.edu email, and I can drop that in the chat again. And we can help to either fix that on the back end or give you the right advice.
Right, thank you. We've had a couple of follow-on questions from what we were talking about submitting one or multiple applications. So let me just focus on that again. So there's a question saying, are you expecting universities or departments to send in one strong application, as there are many different teams in the same department? So there's nothing, like I said, there's no restriction in you submitting more than one. We just would encourage you to put your strongest applications forward. And we really are expecting to see distinct ideas. So we wouldn't want to see 2 applications that were similar. So you will still need to work internally to have those conversations and make sure that you are joined up when you do apply, but there's nothing stopping you submitting multiple applications. Okay. I'm just checking what the next question is. Oh, this is a good question. So to Noel, the proof of concept stage that we're accepting, does that need to be focused on antibiotics, or can it involve other types of product that are then the technology or the data solution is applied to this challenge?
No, if you have an existing solution that is working in another field, and you do have that sort of preliminary prototype built and you have some preliminary evidence or data that it works, that is completely fine if you have not yet applied it to the field of antibiotic stock control or substandard and falsified antibiotics. We still absolutely encourage you to apply, and we think that this is, you know, a opportunity to see some real innovation in this field.
Great, thank you. And just another question here about the type of organisation and the eligibility criteria. So Noel, can people apply as individuals or groups of individuals, or must they have a registered organisation to be able to apply?
So in order to submit an application, you can apply as individuals or a group of individuals, that's fine. However, you do have to be a registered entity in order to accept the prize funding.
Great, thanks, Noel. Question for Sally. Is there any limitation on the geographical locations of, for example, the stock control element of the challenge, other than LMICs, of course?
Well, I was just going to say that point, that we're focusing on low and middle income countries. So I'm not interested in stock control in Britain or America. So I think you're focusing on once it gets into your country or your region at the highest level. But, you know, the judges will look at it. But I don't see the relevance really of high income country data. It's a bit like having hospital data. We're focusing on people in low and middle income countries in the community. What are they getting, and how's the stock control helping them get appropriate antibiotics, and how's quality control making sure they're safe antibiotics?
And also
and the animals, of course.
Yes,
I got that. Sorry. Yeah.
it's okay. And just to follow on from that, we don't have a specific geographical location or scale in mind. It could be a regional level project, or it could be smaller than that.
Yeah.
If we can prove the innovation and that can scale over time. Great. Just bear with me while I check the questions. There's another question here around, again, types of organisations applying, which I think is a quite common theme. So we're a technology company applying for the challenge, partnering with a local Ministry of Health for the actual implementation pilot of the technology. Are there any restrictions around this? And I think based on our eligibility criteria, the ministry cannot be the recipient of the funding, but they can be an active partner in helping make sure that the solution is deployed appropriately in that location. I don't know if the panel want to add any more to that answer.
Well, let me explore that a bit further, because of course that's right. So the tech company, if it's in low and middle income countries, can have the grant. They can work with the ministry, who will then be working in the community. So they can have a subcontract or pay for activity within the community that the Ministry of Health is kind of directing and working with you. But the idea is to really focus on the community, and we don't have the ability to fund ministries of health or agriculture or their agencies.
Thank you. Just a couple of questions for Noel about the platform again. You may need to get back to people on this one, which is fine. So there's a question around citations. So this question is around how can we add citations to the application text? The website doesn't seem to allow for that. Is that one that we should take offline and get back to people on?
I can answer a little bit now. and then we can follow up. So you should be able to, if you'd like, just put footnotes at the bottom of your response in relation to whatever you're citing. You should also be able to hyperlink within your response. I've seen a lot of people do that. If you're having trouble with either of those options, though, again, feel free to reach out to help@solve.mit.edu, and we can help get your, specific questions sorted.
Great, thank you. And there's clearly some innovators on our webinar today. So the question here is, can the same solution be submitted to another MIT Solve challenge? And would you recommend that, Noel? Or I imagine there'll be very different criteria for your different challenges.
Yes, so absolutely. We encourage you to apply to other challenges that may be open. Of course, you should review carefully the details of other challenges that you apply to, because they may have slightly different eligibility criteria. They may be looking for slightly different things, so you may want to adjust how you're presenting your solution.
Great, thank you. And then I think I can answer this next question. So this question is around the number of partners that may want to come together to create a team to apply. Is there any limit for the number of partners or in the consortium for submitting an application? No, there's no limit. Clearly, you'll have to budget accordingly depending on who your partners are, but no limit. Any number of partners can be part of the solution, and we're expecting there to be multiple partners, given the nature of this issue that we're trying to tackle. And then the second question following on from that is, can the technology support partner be part of the consortium? Yes, absolutely. That's absolutely fine. That would be brilliant. So yeah, the technology support partner can be part of that. A question again on the application portal to Noel. Does the platform or application portal allow adding visuals like workflow diagrams or screenshots of the product?
Yes, you are able to add visuals into your responses. However, I would encourage you as much as possible to not necessarily rely on those visuals. Focus first on the text response that you're putting in for each of the questions, and then think about adding visuals.
Okay, let me just check the questions coming through. This is a question I'll direct to Sally, if that's okay. So there's a specific question around the kind of community level data or evidence that we're expecting. So, and it's related to the proof of concept stage, that very early stage that we are accepting applications against. Could you say a bit more about how detailed that kind of community level evidence needs to be? What would you be expecting for that proof of concept stage? And Noel, feel free to come in as well.
I mean, it will come back to who else applies, the competition, and how the judges assess it. But if you're going to take as your innovation a solution that works somewhere else, you need to show that it really has worked somewhere else, and then give a very convincing explanation why you can put it into a certain community, which you map out, and that it will work, or it really should work. So if it's already in that community but doing something else, then that might be quite easy. But the further away it is geographically or in subject, the more difficult it might be to make that link and show that it could work. So it is really for you to make the case that there is a proof of concept that works in another area, and that you can transplant it across into AMR in one of these two ways, quality or stock control. And it's doable, but it's for you to make the case, I would argue.
Thank you, Sally. Noel, did you want to add anything to that one?
I would just say, if there's any data that you don't currently have on your solution, it does mean a lot if you're able to include a detailed plan or vision of how you are going to gather that data in the future. So knowing that you have thought through that part of it is going to be really important when the judges are evaluating your solution.
Great, thank you. And we've had another question, very simply, can existing data be used? Absolutely, yes, that is great. Please do showcase that in your application. A question about the prize fund now, if we can move on to that. So the question, and I'll direct to Noel on this one, can I apply for more than £500,000?
So £500,000 is the maximum prize fund, obviously with the aim of giving 2 joint grand prizes of that amount. You can absolutely state any additional funding that you may have already secured, or that is yet to be raised in your application, and that will be evaluated by the judges. But for the purpose of this challenge, you cannot request more than £500,000.
Thank you. I've got a question about partnerships in low and middle income countries. And Sally, perhaps if I could ask this one to you. There's an applicant here who had a strong and potential partner, but it's falling through. Do you have any advice for teams like this that need to seek suitable partners at this stage? I know we're only a month to go until the application window, which is tricky.
I'm really sorry to hear that. If you've got a good application, I mean, that's helping as a dating agency isn't part of our role. I wish we had the time to do it. So I think it's a question of asking among public health people and vets. I don't know where you're based, but the Food and Agriculture Organization, the World Organization for Animal Health, and WHO all have people in different countries, and they would be good people to talk to about who in those countries would be worth working with. Or do you have a link with one of the universities or even the public health community? So sorry we can't do the matchmaking, but I encourage you to reach out and find people.
Thank you, that's really helpful. There's another question here on the One Health aspect of this challenge. So Sally, perhaps if you could just say a few words about what you're looking for there.
So we really care about antibiotics being used, being high quality and appropriately. And that could be for humans. It could be for the food chain. It's mainly animals, but plants too. And we worry about where they end up. So there's something about how they're disposed of, and that takes you into the environment. Now, I think it'll be quite difficult to do a solution that covers everything. So we're happy to accept solutions that focus on humans or on the food chain, or that look at discharge maybe, but then you'd have to persuade us of the link with quality, I think, for there, and that would be more difficult. So don't feel you have to do all of it. But if actually locally in a low-income country, the supply of antibiotics for farms and humans is from the same market stall, you might want to put both of them together, and then we'd be thrilled. But we're not forcing you to do One Health. We're saying we're open to applications that are on any of these issues or that do bring it together. But, you know, if in your local town or village they are put together, then it would be odd to separate them. So we leave it to you as you're the experts of what's going on locally.
Thank you. And it looks like we're getting through most of the questions now. So if anyone on the webinar has any burning questions that you really want to submit now in the next 30 seconds, then please do so. In the meantime, I will just ask a couple more to our panel.
I think there's one about public health facilities.
Yes,
which
great.
is interesting. And we may have to take away, what is community? Well, I can imagine public health, and in fact, I've visited some in Nigeria, facilities where it is based in the community and it's relatively small, and it may be an outreach of a hospital or of a public health institute, but it is focused on the community. That's fine. It's what we don't want is hospitals or big veterinary facilities. We're not looking at the bigger picture. We're looking at what focuses on the people in that community. And therefore, it's for you to make the case that a public health facility is community focused.
Great, thanks, Sally. And perhaps if you wouldn't mind taking the next question around antibiotics and how they address different diseases. So target diseases don't require a common antibiotic, and so does one antibiotic address a single disease? Not entirely sure about how to narrow down the solution by drugs or by disease.
The Bible on this for human health is the Access Handbook. But some antibiotics, well, most antibiotics will attack a number of bacteria. And so you might do an application that deals with one antibiotic, a common one, and it needs to be oral or in the animal side, put into the feed or water for the animals or fish, or about multiple antibiotics. But you're not worrying so much, you're not thinking about stewardship and how do they make sure that patients or animals are getting the right antibiotic. You're looking at, do they have good stock control of these oral antibiotics, the access antibiotics of the WHO, and are they good quality?
Thank you. And there's one question here about national regulatory authorities that Sally, would be great if you could say a few words on. So they would be required to implement the solution or the findings.
So they are an agency of government, therefore we will not fund them. On the other hand, they are likely to be the ones who could pick up the solution. So as a partner who advise and help you, I think they could be very useful. But we're not going to be passing significant funding to agencies or ministries of government, agencies of government or ministries. This is a challenge aimed at innovators, whether they come from academia or tech or just from the communities. You know, look at this problem differently, but you will need to think how to scale in the future. And that's where the agencies and ministries come in.
Yeah, crucially important. Thanks, Sally. There's a question here that we're running out of time, but we do have a couple more questions. So there's one around innovation. So Sally, perhaps if I could stay with you, what would you see as innovation for this challenge? Is it about finding that missing data that we just don't have at the community level, or is it something more than that?
Innovation can be in behavior or technology, and in data, it can be about bringing it together differently or amplifying data. So missing data, it may well be key to what's going on. It's just you have to make the case for why you would be collecting that missing data and what you do with it to improve stock control. But I guess that in villages and markets and small pharmacies, there's a lot of missing data. The question is, what do you need to collect and how would you handle it to improve stock control? What do you need to collect to improve quality control?
Thank you. Thanks, Sally. One final question for Noel on the practicality of applying and how to organise budgets. So could you answer this question, which is, can you provide a budget template? And is there a specified template to guide or tailor your response to this competition?
Sure. Okay. So for the first question around budget templates, we cannot provide a budget template. And I should clarify that we're not looking in the application for for example, month by month budget for how you would use this prize funding. What we are mainly interested in is splitting your budget into those 3 categories that Louise shared earlier. So direct costs, real indirect costs, and true overhead costs. Moving on to the second part of your question, which was around how to sort of tailor responses. That's a challenging one. We can't tell you exactly how to tailor your responses to all of the questions in the application, but I can give you a couple tips. First of all, like I said earlier, make sure you review the eligibility criteria so that you know how your application will be reviewed or assessed by the judges. The other thing that a lot of people find really helpful is looking at previously successful solutions. So I would recommend that you take a look at folks who applied to last year's Trinity Challenge and who were selected. You'll see how they presented their solutions in a really successful way. You can also look at some of the other challenges hosted by MIT Solve if you want other ideas.
Thank you, Noel. So that's it from us in terms of your questions. Thank you so much for engaging with us. That was brilliant. Lots of really interesting, thought-provoking questions. We really appreciate it. I hope that you found that session useful. We have recorded it and we will share that recording with you. And please do take a look at that challenge platform. It should be able to answer lots of your questions that perhaps we haven't got around to today. We really hope that you decide to put an application in by the 24th of April. I would also like to say some thank yous before we wrap up. So I would like to thank our donors who have made this challenge financially possible. And those are the Wellcome Trust and the Institute of Philanthropy, empowered by the Hong Kong Jockey Club Charities Trust. And thank you so much. We're very grateful to them and for all of our other supporters for their continued support of the Trinity Challenge. So, as we said earlier, if there's anything that we haven't been able to answer today, or you're not quite sure if we've fully answered the question that you had, please email us using the two main email addresses. So info@thetrinitychallenge.org. If you need help with the application platform, please use help@solve.mit.edu. We regularly share information between the two teams, so please don't worry if you can't remember this. Just note down those two email addresses and use those if you have any questions. We have a very short survey which will pop up after we finish today, and it will take no more than a couple of minutes. We really appreciate it if you could feed back to us and tell us what you thought of this event so we can improve in the future. And don't forget to follow us on social media for the latest challenge news and updates, and sign up to our newsletter on our website, www.thetrinitychallenge.org. So my final thanks go to our panelists, Dame Sally Davies and Noel Shaskan. Thank you so much for joining us today, and to all of you for attending. We really look forward to reading your applications. That's all we have time for now, so thank you, goodbye, and best of luck.